Every year, around 70,000 lives are tragically lost to opioid-related overdoses. Opioids such as oxycodone and fentanyl have played a significant role in this crisis. Opioid overdoses are often the result of a complex interplay of factors, including practices within the pharmaceutical industry, the overprescribing of opioids by medical professionals, and the illegal production of fentanyl in countries such as China, Mexico, and India. The situation has become even more intricate as fentanyl is frequently disguised as other medications and smuggled into various countries, putting countless lives at risk of accidental overdose. Before we delve deeper into the complexities of the opioid crisis and fentanyl, please hit that subscribe button and ring the notification bell so you don't miss any updates on this critical issue. To understand the current opioid crisis, it's essential to distinguish between opiates and opioids. Opiates are natural compounds like morphine and codeine, derived directly from the opium poppy plant. In contrast, opioids is a better, broader category encompassing natural opiates, semi-synthetic opioids such as heroin, and fully synthetic opioids like fentanyl. The presence of opioid receptors in the human body is because our bodies naturally produce their own opioids, referred to as endogenous opioids. These naturally occurring opioids interact with receptors and play crucial roles in various bodily functions. When we experience pain, our body undergoes a complex process. Pain signals are transmitted from an injury site through the spinal cord to the brain, allowing us to become aware of the pain. This pathway, known as the ascending pain pathway, is responsible for this perception. Within the brain, neurotransmitters such as glutamate and GABA, or gamma-aminobutyric acid, play pivotal roles in the modulation of pain signals. GABA, in particular, has inhibitory effects that can either enhance or suppress the pain signal. This is where opioids come into the picture. Opioids function by interacting with opioid receptors, and there are three primary types: mu receptors, delta receptors, and kappa receptors. Among these, the mu receptor is the primary target of opioids, including fentanyl. These receptors are distributed throughout the body, with abundant mu receptors found in the digestive system, which explains a common side effect of opioid use: constipation. In the nervous system, mu receptors are found in the spinal cord, particularly in a region known as the substantia gelatinosa. Furthermore, they are present in the brain, including the brainstem, thalamus, cerebral cortex, and the mesolimbic pathway. The mesolimbic pathway is especially critical for understanding addiction. This pathway involves the ventral tegmental area communicating with the nucleus accumbens, affecting the release of dopamine, a key component of pleasurable experiences. When opioids bind to mu receptors in the ventral tegmental area, they reduce the secretion of GABA. This leads to increased dopamine release, creating the pleasurable sensations associated with opioid use. However, the pleasurable response can result in addiction, as individuals often require progressively higher doses to achieve the same level of satisfaction, driving the cycle of addiction. Fentanyl is renowned for its remarkable potency, being approximately 100 times more powerful than morphine. In specific medical situations, such as cases of severe pain or for patients who have developed a tolerance of morphine due to prolonged use, fentanyl is legitimately used. Anesthesiologists often employ fentanyl for surgeries and epidurals, and it proves to be highly effective in these contexts. However, the presence of fentanyl on the streets, resulting from its illegal production, has led to a significant public health crisis. Overdosing on fentanyl is an alarming concern, primarily because of its impact on the brain's respiratory centers located in the brainstem and hypothalamus. These centers continually monitor and regulate respiration, adjusting the levels of oxygen and carbon dioxide in the bloodstream. In cases of opioid overdose, these centers can become overwhelmed, making it impossible for the body to breathe normally. This condition, known as respiratory depression, can be fatal. The sole remedy for an opioid overdose is the administration of naloxone or Narcan, another medication that competes with opioids for the same receptors. By binding to these receptors, naloxone displaces the opioids and allows normal respiration to resume. However, it's important to note that naloxone can swiftly induce opioid withdrawal, which is an excruciating experience for those who are dependent on opioids. Opioid withdrawal is a difficult and painful process, and it's not exclusive to fentanyl. When the body becomes dependent on opioids, it adapts to their presence, which includes the absence of pain signals. This means that even non-painful sensations, such as the touch of clothing, can become agonizing when individuals who are opioid dependent go through withdrawal. The pain experienced during withdrawal is not solely due to the absence of the euphoric effects of opioids. It's also related to the heightened sensitivity of neurons that have adjusted to not sending pain signals while opioids are present. This withdrawal experience is both emotionally and physically agonizing, contributing to the cycle of addiction and drug-seeking behavior. The opioid crisis, with a specific emphasis on fentanyl abuse, is a significant problem, particularly in North America. The crisis is the result of a combination of factors, including the practices of pharmaceutical companies and overprescribing of opioids by healthcare providers, and the infiltration of illicitly produced fentanyl from various sources. Fentanyl, with its legitimate medical uses, is now a major street drug due to illegal production, causing widespread misuse and overdoses, contributing to a severe public health crisis. Recognizing its potency and dangers is vital to combat the opioid crisis, emphasizing education and awareness as crucial steps in addressing this devastating issue. If you or someone you know is dealing with opioid addiction, seek available resources and support. What are your thoughts on the role of pharmaceutical companies in the opioid crisis? Share your thoughts and experiences in the comments below. Let's keep the conversation going. Also, don't forget to hit that like button and subscribe to our channel. Stay curious, stay inspired, and always remember that your well-being is the ultimate treasure. Here's to a life filled with vitality and abundant health.